Hello, my name is Tine Verdonck and I'm the file holder of this module with the title Public Health Approaches to Zoonosis Control. I'm very happy that every one of you has replied to our questions on the forum, so we're sure that you've thought a bit more about what public health means to you. I'll immediately say that there's not one correct definition of public health. In fact, many different definitions are circulating, and the way you perceive public health, I think, is an important part of this module. So today, I would like to give you some feedback on your input on the forum, and I've invited two colleagues from the Department of Public Health here at the Institute of Tropical Medicine in Antwerp, Bart and Marjan, who have a lot of experience in teaching about public health, but not only teaching, exchanging with master students about what public health is.
Okay, well, I'll briefly introduce myself. My name is Marjan Pirard. I'm a GP by training, and I have working experience in Zimbabwe, so in Southern Africa. I worked in a district hospital, and then I also did some more disease control research work in a tropical institute in Bolivia, so in Latin America. So this coincides nicely with the background of you as a student group. But the last years, the last 15 years, I've worked as a coordinator of a master in public health. So I have heard the experience of quite a number of public health professionals from all continents. And I would like to share my experience with you later on.
Good afternoon. My name is Bart Criel. I'm a medical doctor by training, like Tine and Marjan. I'm currently a professor here in the Public Health Department and teaching master students in our Masters of Public Health, mostly health professionals, on organization of health services, management of local health systems, primary healthcare and the like. My professional experience as a practitioner is situated on the one hand in Belgium, where I worked for some time as a general practitioner and for a year or so in a hospital in the Department of Internal Medicine. And then I spent some 8 years in the DRC, the former Zaire, Democratic Republic of Congo, and this has been really a major learning experience and also shaping my understanding, I think that's the good word, my understanding of what public health eventually is about.
Now I would like to focus on your replies on the forum, and perhaps Marjan, could you start with a short presentation of who you are?
Well, I hope you've read the contributions of each and everyone, but I would like to summarize a bit, the characteristics of the course participants. So you are 10 participants of this Master in Tropical Animal Health who have chosen for the module on public health approaches to zoonosis control. This year, because this is the second year we organize this module, this year is different from the previous year where male participants were the predominant group. Now is the inverse. We have 7 female participants and 3 male. I think this is a bit unusual in animal health. That's what I was told, at least. The majority comes from Africa. We have 8 African participants, but going from north over east to South Africa, and then 2 Latin American students. Your background is mainly veterinary medicine, at least that's what I've read in your contributions, and 2 of you are biologists or microbiologists. But in your professional work, I think your experience is quite diverse. It goes over animal health care, and then animals can be it wildlife, farming, or companion animals. And then there's people working in labs, doing surveillance work, some do research work. One of you is involved in training. And I think one particular person is working in a public health institution and might have maybe more insights in what public health is.